Hey everyone, my name is Kelby Hightail of Medicare Hub, and I bet Medicare is extremely confusing if you have began the journey of looking at different health plan options, Medicare Supplement, Medicare Advantage, prescription drug plans. Maybe you're 65 years of age and just getting ready to enroll into a plan, or maybe you're 68, 75 and older and you're looking at why is this so confusing? How do I simplify this down? Well, today I'm going to be covering with you for those of you that are interested in enrolling into an original Medicare and getting a Medicare supplement. What are the insider tips on really choosing the right supplement for you? I'm going to break down really 3 essential things you need to know. If you know these, it's going to simplify the art of enrolling into a Medicare supplement. If you don't know these, it's going to create more confusion for you in the future. Stick around. I'll be back in just a minute to go over these 3 tips. All right, guys, we are diving into the 3 tips of really understanding the insider tips of choosing original Medicare and then choosing a Medicare supplement. I'm going to cover 3 things that are essential to knowing what supplement to choose and why to choose that. And if you just follow these 3 simple guidelines, it's going to allow you to choose the right plan for you most of the time when choosing a Medicare supplement or Medigap policy. And then also, I would like to invite you to be able to stop and to like, to subscribe, and also to share this content with your friends and family, those around you that you know that are maybe 65 years of age and older. It's a great guidepost. The content that we do put out, it's all about educational, and I like to say we like to identify a problem and then provide a simple solution, or as we like to say, we know Medicare is extremely confusing, so we're here to make your life easy by making Medicare simple. So I'm going to make choosing a Medicare supplement plan and what options that are available, because like in our market, there's over 15 plans with over 70 different plan options. There's hundreds of plan options in probably your zip code. And how do you simplify that down to choosing a Medicare supplement plan? I'm going to go over 3 tips for you today. And then if you need help, I'd love you to be able to go below, click, or call us and schedule a time. We'd love to have the opportunity to guide you through enrolling you and guiding you through the process of enrolling into a Medicare supplement plan, if that's so be the options that you're looking for, or a Medicare Advantage plan. We do any and everything with our brokerage. We specialize in Medicare health plans in general, and would love to be able to help you. So let's go over these 3 tips. Consider original Medicare if, and this is really answering the question, why would someone stay on just Medicare and then go to a Medicare supplement? Well, I always like to say, if you live in an area for 6 months or longer, you can enroll into a Medicare Advantage plan. If you live in an area, primary residence is not going to be in the area that you live in for 3 months, up to 6 months, or 2 months, up to 6 months. Let's say you live here, you live in Arizona, and you have a place in Florida, and you migrate between the 3 places 3 to 4 months different times, and you're going to continue to do that until you pass away or you get to the age and health level where you're going to choose to be a primary resident in one of those locations and maybe sell off some of the real estate that you own. I would say staying on original Medicare and choosing a Medicare supplement is essential, because guess what? As you are here, you may have access to a doctor, but then when you migrate and you go to Arizona during the winter time, you may so choose to have a specialist or primary care doctor access to care there for your healthcare needs, especially as you progress and get a little bit older and you maybe have a condition that you have to have maintained, like diabetes. I would say if you're living in an area and you're accessing care, or you're saying, hey, I'm not going to just wait and come back to my primary residence in the state, I want to access care in the areas that I live at throughout the change of seasons when I'm migrating around to the 3 different locations or 2 different locations, then I would say choose original Medicare, choose a Medicare supplement, because it's going to be the easiest way for you to access care without any health just any regulated reasons or problems that you can run into by being on just original Medicare and enrolling into a Medicare Advantage plan that is subject to networks and changes and things like that. That's going to create complications for you if you're going to travel and be out of the state that your residence in. Every 6 months, basically just know 6 months and beyond, you're good for a Medicare Advantage plan. 6 months or less, you're here for 3 months, somewhere else for 3 months, somewhere else for 3 months. I would encourage you to choose a Medicare supplement plan. It's usually the best option. So that's number 1 reason. And then insider tip number 2, supplementing original Medicare. So exploring Medicare supplement plans or Medigap plans. There's 10 plans. We typically focus on 3 main plans. If your birth date was January 1st of 2020, when you turned 65 and before, you can still enroll into what they call a Medicare Supplement Plan F. And if you're coming off an employer-based plan and you're going to go into a Medicare supplement, you're going to be required to go into a guaranteed issue Plan F. Now, if your birth date 65 years of age and beyond January 1st of 2020, we typically see two plans, and really one plan is what most of our clients do, is a Plan G. Plan G is going to cover 100% of everything that original Medicare covers. The Plan F, for those that are looking at Plan Fs that are at a certain age and before, the Plan F covers 100%. So original Medicare Part A and Part B services are going to have deductibles and co-insurance. I always say it's this big, huge question mark on what you're going to pay with original Medicare. Thus is why you pay a small premium to have a Medicare supplement to pick up what original Medicare doesn't cover. So the Plan F is going to cover 100% of everything Medicare doesn't cover. And there's no access denied to going to any doctor, specialist, or hospital that it takes original Medicare. The Plan G is going to cover 100% of everything except for the Part B deductible. And the Part B deductible, right now is about $240. Typically, it's going to be $300 or less. That's typical as the progression of the Part B deductible goes up, depending on how many years ahead of this video you watch it. Just know the only thing you're going to pay is the Part B deductible. Then 100% of everything. And again, the access to care, whoever takes original Medicare, any doctor, hospital, anywhere in the U.S., you're going to have access without any limitations. And then the supplement's going to come along and pick up 100% of everything except for the Part B deductible. So I would say when exploring Medicare supplement plans, and the other third option is a Plan N, as in Nancy. Plan N, you're going to pay the Part B deductible. You can be subject to up to a $20 copay to access care for your primary care doctors and your specialists. You can be paying up to a $50 copay if you go to the ER. And then there's some excess charges that original Medicare can assess, and there's some fees based into that Plan N that you can pay up to. And I always say for about $30 difference in premium, about $300 to $400 a year in premium, you have the headache of having to keep up with copays or up to a copay amount with a Plan N. So I typically just tell my clients, eliminate that headache, pay $20 or $30 more a month in premium, and then just have the Plan G. And the only thing you're going to have to worry about is paying the Part B deductible. Again, $200 or $300 that you can set aside and pay the Part B deductible. And then 100% of everything else is going to be paid. And then if you do have a bill that's sent to you for whatever, $2,000, $3,000 from a hospital stay, the hospital's not billed your insurance correctly. You're going to call our office. We're going to walk you through the steps or do that for you to submit original Medicare, your supplement, and have that bill paid. Mine is just your Part B deductible if it's subject to that, depending on the services that you have. So that is my overview. Let's kind of recap on that. Why would you stay on original Medicare and choose a Medicare supplement if you're traveling and you're not going to be in your resident states for longer than 6 months and you travel every 3 months or 4 months to other areas of the U.S., I would say get a Medicare supplement plan because you can access care anywhere that you go, have a surgery. You can travel somewhere and stay somewhere like in Dallas and have specific like cancer treatments done in Dallas that maybe you couldn't get somewhere else. So the Mayo Clinic in Cincinnati, wherever you want to be able to travel and access care. If you're outside of your state, your resident state, beyond 6 months or longer, you need to choose a Medicare supplement plan. It's just how the rules and regulations work for Medicare Advantage. But I say access to care is very important. The second thing is there's 10 plans that are available for Medicare supplements. We usually focus on 3 plans. If your birth date, if you turn 65 prior to January 1st of 2020, you can be eligible for a Plan F. If you're coming off an employer plan, you have to go on that. It's called a guaranteed issue. And there's rules and regulations around that. If not, you can choose to look at a Plan F, Plan G, or Plan N. We typically, not 100% of our people choose a Plan G, but once Medicare supplements are explained, and the premium savings and for the coverage, the Plan G, the great thing about Plan G is you pay the Part B deductible and then 100% of everything else is covered. And the last thing is don't go at it alone. There are resources and help choosing a plan. One of the resources and help it can be is our agency, which is Medicare Hub. Maybe you don't know us well enough at this point. Below is going to be a free link for you to be able to access a Medicare Made Simple on-demand video. It's going to go over everything, a comprehensive look at about 40-something minutes of video. It's going to go over everything you need to know about Medicare with a guidebook. So You can download the guidebook, print it out, follow along, take notes. The other thing is, if you just call, we're going to do a free review. It doesn't cost you anything. We're going to walk you through and educate you about Medicare. We're going to collect your information based on your doctors, your specialists, and needs. And we're going to evaluate what's going to be the best fit for you. And if you say, hey, I'm going to be traveling to multiple states throughout the year, I'm going to say you need to probably choose a Medicare supplement. If your options are different and you're looking at a Medicare Advantage plan, we're going to choose a plan based on your doctors and your specialists and your access to care needs. Those are the most primary things that most people are going to look for. So the third thing is, don't go at this alone. Medicare is extremely confusing. We love to be able to make your life easy by making Medicare simple. You can click, call, and access us anytime online, or pick up the phone and give us a call. We'd love to be able to help you. And if not, I'll be seeing you on the other side. And until next time, have a great day.